Good morning, Mr. Chairman and members of the committee. I'm really proud to be part of this bipartisan bill package and to be the primary sponsor for House Bill 4630, which addresses the problem of nurses having to work excessive amounts of overtime. I'm the daughter-in-law of a nurse and a sister-in-law of a student who is on her way to become a nurse. And I know that the top priority of any nurse in Michigan and across the country is doing a good job caring for and protecting their patients' health and safety. But the reality is that they can't do the job they want to do if they're working 16 hours or 18 hours in a row. The way it stands now, there is no limit on the number of hours a registered nurse can be ordered to work. That's not good for nurses, and that's certainly not fair or safe for patients that depend on them to keep them safe and cared for. Right now, hospitals can order nurses to work unlimited hours, even up to 24-hour shifts. When nurses are exhausted or sleep deprived, they cannot help but make errors, unfortunately, sometimes life-threatening ones. Nurses often cite the inability to refuse excessive hours as a reason for leaving hospital care or the nursing profession itself, or in the case of Shelby Kivala, one of the reasons why she moved to another state to work as a nurse instead of Michigan. We've heard many nurses say, the money is not worth it. You can't pay me enough to work so many hours that I'm putting my patients at risk like this. Senator Casperson, who sponsored the identical bill in the Senate, speaks passionately about this common sense legislation because he comes from an industry, truck driving, that has to follow laws about how long employees can work on the roads. The government limits hours for truck drivers, airline pilots, locomotive drivers, and others for public safety reasons, and we believe that the same should be the case for nurses. House Bill 4630 simply aims to set safe limits on working hours. We're not asking hospitals to end RN overtime altogether. We all recognize that that would be unrealistic. It prohibits hospitals from ordering RNs to work more than 12 consecutive hours in special circumstances, and it requires that nurses get at least 8 hours off after a 12-hour shift to rest. House Bill 4630 also addresses another important problem, which is that registered nurses right now have no right or ability to say no when ordered to work overtime. If they try to say no because they're too exhausted to take care of patients safely, they're often threatened with disciplinary action, being fired or losing their license. This bill would protect nurses from discipline, termination, or loss of their license when they decline unexpected shifts beyond 12 hours. It's important to point out that the requirements of this bill would be suspended in cases of an unforeseen emergency, such as a pileup on the highway or a flu outbreak. And registered nurses could volunteer to work those additional hours if, in their professional judgment, they are able to continue to provide safe care. And the last exception is that if the nurse is in the middle of a patient procedure that extends beyond that 12-hour shift and the nurse's supervisor believes that the nurse's leaving would be harmful for the patient. There's a wide support for this bill and bipartisan co-sponsorship because I believe that we all understand the consequences of the problem that nurses are facing and that patients are facing. And no one that I've talked to has said, yes, I'm fine with having a nurse who has been working for 14 hours straight, taking care of me or my loved one. House Bill 4630 is a fair, common sense solution that will go a long way toward keeping more people safe from harm and to keep more nurses in the profession here in our state. I urge the committee to strongly consider enacting this common sense legislation to make healthcare better and safer in Michigan. Thank you.